Well, Dr. Beck, what type of people could or should come to your office? We know that you are helping people with, seeing where and which nerves are not working, and then from there figure out why they are not working. And many times that has to do with arthritis, with things which demand physical therapy to fix. Muscles and nerves are just not working in harmony. What else does the muscles and the nerves affect, and conditions which you treat and can help out with?
Well, that's a great question. A lot of people don't know some of the conditions that we treat. As you mentioned, nerve testing is one of the primary things that I do in my practice, looking at problems resulting from nerve injuries such as carpal tunnel syndrome, pinched nerves in the neck or back. I also consider myself a musculoskeletal medicine specialist, and we treat a lot of sports medicine type injuries, strains, sprains, things of that nature. Some of the conditions people don't realize that we treat involve the central nervous system. For example, I see a lot of people with strokes. I also see people who have had severe head injuries. In other words, they've been in a car wreck, they've had brain injuries, and I also see people with spinal cord injuries. This is people who have been paralyzed, often from the waist down, sometimes from the neck down. So I tell people that we see everything from strains to strokes. It's a very wide-ranging practice, and we see people with a lot of different kinds of problems. And we can treat them often with physical therapy, often with nerve testing, but oftentimes we need a very comprehensive approach because these are complicated problems.
Okay. What do you call a comprehensive approach? Give us some examples there.
Let's say I have somebody that has had a spinal cord injury. In other words, they can't move their legs. They have a lot of different problems. They have trouble dressing. They have trouble getting around from the car to their bed or, in and out of the house. They have trouble dressing, bathing, eating. All these things can be very challenging. So I can't fix all these things myself, and I have to work with a team of people. This often involves both physical therapy, occupational therapy, speech pathologists, and oftentimes clinical psychologists as well, particularly if there's a head injury where there's problems with the thinking and reasoning that's been caused by brain damage.
I see. So what you're telling me is, due to the fact that you do nerve testing, you are very able to detect where the problem comes from, but then in order to fix it, you might sometimes need a whole team, and then you know where to send the person to so that he gets this fixed and that fixed and that fixed.
Yes, frequently we're sort of coordinating care with a variety of providers, and people with severe nerve injuries often have a variety of needs. And again, it could range from everything: I can't feed myself, I can't go to the bathroom, I can't get my clothes on. And this usually requires a lot of different people helping, and we have to kind of coordinate all that care so that, the hand knows what the other hand's doing.
Right. And then you're kind of that central contractor. You're the general contractor.
That's right.
Okay. You're the guy who designs the plan.
Yep.
And then, of course, each specialist in his area will design his plan while yet coordinate with the other guy who designed his plan.
Yeah, that's really the key, is making sure everybody knows what everybody else is doing and that we all approach things with one goal in mind so that, again, we don't have people doing one thing that the other doesn't know about.
Mm-hmm. Well, how do people know, let's just say, a person had a stroke. How does he know that he should come to, I would never have thought that a stroke person should go to a physical therapist.
Well, a lot of people don't. And basically, if you're having trouble doing the things you need to do around the house, again, basic things, getting your clothes on, getting out of bed, getting from the bed to the bathroom, these are the kind of things that really need help, and we can help with, both through physical therapy and physical medicine.
I see. So when my wife says that she thinks that I should be paying more attention to the garbage can taking out, I should actually start seeing you.
Yeah.
Because
we'll send you to the therapist.
I don't seem to be able to do the things I'm supposed to do. All right. Okay, Dr. Beck. Thanks a lot.